guys, and welcome back to Masala Chai with Dr. Aunties. I am Sonal Patel. I'm a pediatrician and a mom of 4 boys.
And I'm Nithya Natarajan. I'm a family physician and mom of 3 boys. And today we're going to be talking about disparities in the birthing world and the BIPOC community. Sonal, do you want to go ahead and start?
Yeah, the reason we took this topic upon, it's not our usually Masala Chai topic, but February is Black History Month, and we wanted to take a moment to recognize history in the medical community as well, and what goes on in our healthcare system that has also led us to this issues of that there are disparities that we see evidently in data like research and stuff like that, and just to kind of go back and how even history relays into healthcare. So let's start with a couple of the topics. First of all, maternal mortality. There's so much data that has come out, and maternal mortality is the risk of a mom dying when she is pregnant or postpartum. And there's a lot of numbers that the CDC uses, the HOA or the World Health Organization used to compare maternal mortality around the countries, around between nations. So just focusing on the United States, we know that Black women in particular are over 200 times likely at risk of dying when they are pregnant or postpartum, meaning that when after they've had their babies. And when we further looked at the data, education, socioeconomic status did not protect these women. So, for example, if you had like a very successful African American woman, let's say she's a physician, and versus someone who is successful in a cashier, it didn't protect either one. Both were at the same risk factors, because then you're presuming, well, if you're a little bit more socioeconomically stable, you might have access to better healthcare, but it didn't protect it. And I think that was very shocking to me to learn that.
Mm-hmm. And I don't know if you saw the study. There was a recent study looking at surgical outcomes. And they were looking at if a man operated or a woman operated, what the difference was. And in the women, when women operated, the women tended to have better outcomes than if a man operated. There was no difference in the outcomes for men. So whether it was a male or female surgeon, men had the same outcomes, but women tended to do better with women.
Well, I don't think we should tiptoe around it. There is definitely medical bias and medical racism that occurs. And I know in my training, I've experienced it with treating, or how someone has helped me treat a patient. And I think you have done it. I think to just forefront and recognize it. And it's not like we're both physicians. Like, let's just openly recognize that there's the systemic issues are present also in our medical community. We shouldn't tiptoe around it. So on that note, you will find I'm a huge advocacy person. Legislation, the Maternal Care Act, and also the Mombas Act that was passed last year is actually looking at these issues head on. So it would be really nice to see that data come out. I know personally, one of the struggles I've had is been encroaching in the African American Hispanic community with the home health services. And I've always worked in a safety net hospital, meaning we provide care to the uninsured. And what I think, from my own perspective and my own opinion, is that when there's an issue that happens in this type of population and someone comes to the home, it's an automatically, we've been ingrained to be like, oh, it's automatically CPS. I mean, Child Protection Service is going to be involved. And that's not the case, right? It's like we're trying to bring care home, but if we've kind of set up a system where those particular populations feel that if anyone comes home, that means that they're in trouble. And they're, and that's what I've noticed with it. And so I don't like to tiptoe around it and be like, you know what? It's there, it's evident in the data, it's evident in where we've practiced. If you're going to be like You're going to be like, no, it doesn't exist. Well, I'm sorry, it does. But it's not to downgrade our profession in any way, it's to uplift it, because we know as scientists and physicians, the best way to learn is to gather data and to figure out the holes and then figure out solution. And if your data is pointing to something, your data is pointing to something. Your data is pointing to the fact that African American women have 200 times the risk of dying. I mean, that's just like, what? Compared to their counterpart. It's insane.
It's totally insane. And I mean, I'm sure you've heard these stories too, where it's like people's symptoms are discounted or they're told not to come in for care, and, you know, all kinds of things that where, you know, if it was a white woman, they would have probably been told to come in, right? But you don't get told the same thing if you're not a certain race. And it's not fair, it's not right. But I think by recognizing that, we can start to address it in our community. And then I think also as a patient, you can really try to advocate, and it shouldn't be your job to do this, but to some extent you have to advocate for yourself more. You know, I think even being like Southeast Asian, like I've experienced racism, and I probably would have died from my hemorrhage if my dad hadn't forced them to like let me come into the office. And I kind of wonder, would the same thing have happened if I wasn't, you know, a minority? And it's so much worse in the BIPOC community, because, you know, we know it is, because things are discounted in a whole different way, and it's hard to fight against everything all the time. And that's what a lot of people are doing. They're fighting for every bit of their life to matter. And your life does matter. Their lives do matter. And we need to recognize that in the medical community, we need to do a better job of taking care of these populations that are not always listened to, are not always taken care of in the same way. And as you said, 200 times more maternal mortality, like that is a systemic issue. That is not, you know, something that's significant in that population that's causing it. That's something in the system that's a problem, and it needs to be addressed. So I'm so glad you brought this up, Sonal. I'm so glad that we're talking about this, because it needs to be talked about.
So I just wanted to dedicate this episode to Dr. Chancey Wallace. If you guys don't know about her, look her up. She passed away in October 2020. She was an African American pediatrician. She was in her 4th year and of pediatric training, and she was a chief. So what that entails is that not only had she gone to college, she'd done 4 years of med school, she'd done 3 years of training as a pediatrician, and her peers, her superiors, her attendings found her so capable of being a leader to train other budding pediatricians. So that's what a chief resident means, that they actually look at the group and say, who is the best of the best? She had decided in her 4th year to have a baby. And as anyone knows in the communities, I always say there's never an ideal time to have a baby in the healthcare system. It's always the less demanding periods. She was able to spend 2 days with this family, with her husband, that she had decided, you know, like it's a commitment in the medical, so you actually actively decide when to have a baby and when not. She had 2 days to spend with her husband and her new baby, Charlotte. She passed away due to complications of preeclampsia, which is one of the top 3 factors of how women die postpartum. So I really wanted to highlight her story, because her story is, I mean, it's very powerful to me, just because I can identify with her in many, many ways. And it's a great loss to the medical community. So for the family of Dr. Chancey Wallace, we're still grieving with you. Her legacy is going to live on because it's in the forefront, and we are totally going to take this head on to figure out how we change the system so she is not lost, and her dedication to the medical community is going to go far beyond what anyone expected. So just wanted to highlight Dr. Chancey Wallace. So, thank you guys.
Thank you.